Thank you so much. I yield back.
Thank you. Mr. Bean, you're recognized.
A very good afternoon, Mr. Chairman, to you, and good afternoon, Ways and Means Health Committee. It's an honor to be on here, Mr. Chairman. Thank you for letting me be a part of the committee. To our all-star panel, welcome. You will always have the chance to say that time I testified before Congress. How about that? Listen, before I go, I got questions. I do have questions, but first I got to correct the record because the other side keeps saying Trump care, and they point to Republicans saying we broke it. Let's be clear, and let me correct the record. Obamacare was created 100% by Democrats. You remember that? Oh, you can keep your doctor. Remember that? It's going to lower costs. None of that was true, and here we are after dumping billions upon billions of dollars into it to prop this system up. We find ourselves wanting more and more for a mediocre system. Of the 24 million people on Obamacare right now, 50%, up to 50% have never made a claim. Yes, they were signed up without their knowledge. It's not working. They don't have a choice. The insurance companies can raise prices. The premium tax credits are based as a percentage of what the insurance company charge. It is broken. The last thing that we want to do is put more money into a broken system. These premium tax credits were done during COVID. Y'all remember COVID? It was a temporary thing. COVID is over. It's over, as should be these premium tax credits. Now, Obamacare doesn't go away. If you're a fan, it doesn't go away, just the premium tax credits. 93% of Americans on this program will still be eligible to receive a subsidized health plan. But we can do better, America. We can do better because right now we are paying $4.5 trillion for health care. That's a lot of money, it is. And when you compare us to other civilized grade A countries, we pay sometimes double and triple per capita what other countries pay, and yet we are getting mediocre results. Mediocre. America, we are sick. We're sick. Maybe it's because we overeat or drink too much or smoke or don't exercise. Our food is lousy. Whatever it is, 60% of Americans have some type of chronic condition that just eats our lunch financially. 42% have two or more. We've got to do better. We've got to do better. And Ms. Reichert, I've heard you say so many times, it's awesome. We are underutilizing healthcare professionals like you, a pharmacist who have that interaction every day with your patients. I know in my area, in Northeast Florida, the greater Jacksonville area, there's a program called Age Well. It's by Baptist Health. It specializes in senior health care for ages 65 or older, and it just has a wraparound approach to deliver care and coordinate it, which we struggle with. We've got work to do, but the answer can't be more money. We've done it. We're out. We're $38 trillion in debt, but we could do so much better by coordinating care, by using technology. Ms. Reichert, what should we do? Right now, the gateway disease. It seems like it triggers so many other things, and it's an horrendous disease. It's diabetes, and it leads to so many other things. What should we be doing? The answer is not more money. You can't say that, but what can we do, Ms. Reichert, to better coordinate diabetes care?
Yes, thank you for this question. And as we said, pharmacists are our most accessible healthcare provider and our most underutilized. And so in chronic disease management, like in diabetes, or whatever the disease is, I feel by allowing pharmacists to be part of that integrated care team, we would be able to help improve outcomes. So in my pharmacy every day, I'm already taking vital signs. I'm monitoring patients' adherence. I am checking for drug-drug interactions, all of those sorts of things. And with diabetes, I have patients come in and I'm monitoring their continuous glucose monitor with them. I'm helping them interpret that
And you're giving
data.
them the advice right there at the window. I have to rush because I've got to get to Dr. Parikh. So that's good, and that means something, that you can tell them take it twice a day with food or not with food, whatever it is, and not eat so much. I know we need to do that. Put the fork down, I think, is probably what I need to hear. I think some of that. Dr. Parikh, how do we get, I know I got 20 seconds left. It's a big question. How do we, first of all, you would agree choice and competition should be part of any healthcare solution. Would you agree? Yes. You would agree. How do we get there? I know that's, I guess, a question. Would you agree with that, though? Yes? Choice and competition?
Choice and competition for,
Healthcare, for letting the individual decide which way they go. What's best for the individual, you would. So with that, that's a conversation for another day. That's where we need to start. Instead of rebuilding, or instead of building onto a broken system, Mr. Chairman, we have work to do to rebuild a system that utilizes choice and competition and puts the patient first. With that, I yield back, Mr. Chairman. Thank you.